Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then the next prognostic index for hepatocellular carcinoma is Chinese University Prognostic Index. In Chinese University Prognostic Index, the components are they are given as BATS, that is bilirubin, A for ascites, AFP and ALP, TNM staging and symptoms. So in Chinese University Prognostic Index, we have albumin, ascites, AFP, that is alpha fetoprotein, ALP is alkaline phosphatase, tumor node and metastasis staging and symptoms. So this is actually applicable for hepatocellular carcinoma, which is associated with hepatitis B in China. So it is applicable for hepatitis B virus related hepatocellular carcinoma in China.
thank you and thank you for watching.